Moving ahead, we've got quite the nasty story here. So this one going around, HHS officials calls Canada's assisted ending of existence fueled organ donation strange new horror. They're talking about the MAID program. Coming from this article here on the Washington Examiner, Deputy Health and Human Services Secretary Jim O'Neill condemned Canada's permissive physician-assisted MAID program for all ill patients, which he has said has crossed ethical boundaries by increasing deceased organ donation rates. It's like they're using this as a way to increase organ donors. It's disgusting, really. O'Neill, the second in command at HHS and acting head of the Center for Disease Control and Prevention, told Washington Examiner in an exclusive interview that he was disturbed to learn that Canada's physician-assisted MAID program, operating under the label Medical Aid in Perishing, has enabled it to become the world leader in organ transplant policy from deceased donors. Demand from the millions of patients worldwide who need an organ transplant greatly outpaces supply, leaving organ donation policy ripe for perverse incentives. In the United States, an average 13 people die every day waiting for an organ transplant. O'Neill and Health Resources and Services Administration Chief Thomas Engels have said that they're trying to revive trust in the American organ procurement and transplantation network after multiple troubling reports of organs nearly being harvested from live patients in several states, including Kentucky and New Jersey. Ugh. But O'Neill said that Canada's program was uniquely problematic compared to even the most egregious stories in the United States. We thought we'd seen all possible horrors, in America, and then Canada has this strange new horror that is really just shocking, said O'Neill. It goes on to talk about the different organ donor rates here. It says the number of organ donors is still relatively small compared to the nearly 16,500 Canadians who died by physician-assisted MAID program in 2024. Canadian Health Services reported in November that roughly 60% of MAID participants in 2024 had cancer, which in most Canadian provinces would preclude them from choosing to donate their organs upon perishing. Goes on to say state laws on physician-assisted MAID program are much stricter than those in Canada, where the National Parliament next month will review whether patients suffering from mental illness can choose MAID. In Illinois and elsewhere in the U.S., 2 physicians or healthcare providers must certify that the patient has less than 6 months to live before choosing physician MAID program. This is absolutely deplorable. And you notice here that it says next month to go on to choose whether mental health can qualify. So with all of that said, we've got this story going around of this 26-year-old being ended for being sad. I can't say this word on here. Technically in Canada, the government can't end someone for being sad yet. This is up for review, as that article said. And we can see that here, February 29th, 2024, extending the exclusion for MAID eligibility, blah, blah, blah. And it says here, eligibility for MAID for persons suffering solely from mental illness within 2 years of the bill receiving the royal assent. That's by March 1st, 2026. I believe they'll start reviewing this, and by 2027, they'll make a decision on it. Now, it does say here, if we look at the bill, an act to amend respecting end-of-life care, it says right here, the bill provides that a person cannot request MAID for mental disorder other than a neurocognitive disorder. So you have to have something else going on, and that's what's happened with this guy here. His name is Keanu Vafanian. He was 26 years old. I found his obituary here. So he had diabetes, he had vision loss, basically blind in one eye, and also mental health. He was struggling badly, and his mother didn't want him to go, and the government approved it. A doctor approved it, which is pretty sick. We can see the mother's post here. With a broken heart, I'm sharing that my baby boy Keanu passed away. I can't read this. Passed away on December 30th, 2025. 4 years ago here in Ontario, where we were able to stop his ending and get him some help. He was alive because people stepped in, and he was vulnerable, not capable of making a final irreversible decision. Tragically, the Canadian system later allowed something very different to happen in Vancouver, where a doctor named Ellen Wiebe approved his perishing based on mental illness. This approval occurred despite the ban until 2027, as I just mentioned. This is Canada now. This is disgusting on every level, and I promise I will fight tooth and nail for my son and other parents who have children that suffer from mental illness. Taking a closer look here at who Ellen Wiebe is, who approved this, Melissa posted another bombshell here. Looks like Dr. Ellen Wiebe, who just ended that young man in BC, and 400 other patients, seems to be the leader of this abortion pill clinical trials. This seems very sick and twisted. So her name right here, Vancouver Dr. Ellen Wiebe, who's running the Canadian clinical trials. This doctor has helped more than 400 1,500 patients perish. Imagine being 72 years old and being responsible for perishing so many people after have already lived that long. There's no words for what's going on in our country. She's admitted to over 1,000 Atitaka was witness to on Salt Spring Island. The comments in here not too kind to Dr. Ellen.